Sir Guido, good afternoon. It's Riza Diaz.
Hi, good afternoon, Lisa.
Thank you, sir. Bart, paki. The news day continues here on One News Now. I'm Riza Diaz. The Health Department says the average number of daily COVID-19 cases in Metro Manila is now on the decline. Let's talk more about this with Octa Research Fellow, Professor Guido David. Sir, good afternoon.
Hi, good afternoon, Risa.
Thank you for joining us, sir. Sir, how accurate is this information? And the DOH reports that, of course, the daily cases are now lower, and we've seen that as well in our daily bulletin. Does this match Octa's data?
Yes, it does. We actually have noted this earlier this week that the number of cases in NCR, average number of cases per day, has actually declined, so it has a negative growth rate. And as of yesterday, what we're seeing is an average of less than 4,000 cases, I think 3,900, and this is 20% lower than the average the previous week. So there is a significant decline. That's minus 20%. That's very good, and it's first time we've seen less than 4,000 average in a while. So 2 weeks ago, it was more than 5,000 daily for NCR.
Sir Guido, is there any chance that the decline in COVID-19 cases is artificial?
We don't think it's artificial because it seems to be a clear trend. That being said, the decline is still, the trend is still unstable at the moment, which means that it can still go up, and we're still getting a significant number of cases. That's still almost 4,000 per day, so that's still significant. But we don't think it's artificial because this is a weekly trend, and the reproduction number that we're seeing is already 0.95, so that also confirms the decline in cases. And also the positivity rate has reduced. I think it's down to 21% over the past week.
Mm-hmm. Sir, what are the chances that we could actually sustain this trend?
Well, we could sustain it if we work towards sustaining it. And that means we should be careful if we're going to ease restrictions. We should do so gradually at best. And we shouldn't be rushing into easing restrictions because as we said, the situation is still unstable at the moment. Cases are still high, and hospital occupancy is still high, and that's going to be a problem for a few more weeks because as we tally 3,000 to 4,000 cases per day, that's still a significant number, and that will mean a lot of people will still require medical assistance.
Mm-hmm. Sir, what are the factors that may have contributed to the decrease in daily cases?
Well, Riza, there could be numerous factors. For one thing, the ECQ was effective in reducing the trend and in reversing the momentum. The virus had an upward momentum just before ECQ, and it was able to reverse the trend. Now, as the number of cases decrease, our programs will start to become more effective. For example, contact tracing will become more efficient, and our testing will become more effective also because as the positivity rate goes down, that means we could test more people, and that way we could isolate them early. So that's the main advantage of having a fewer number of cases. Our contact tracing and testing becomes more efficient.
Sir, just to reiterate the information that we received from you earlier, what's your latest data again, sir, on the virus reproduction rate? And is this expected to decrease further?
Yes, right now what we're seeing as of yesterday is 0.95, so it's less than 1, so that's really good. We want to target less than 1, and we need to sustain it at below 1 for a few more weeks. When it's less than 1, it confirms that the overall trend is downward, and but we can't afford to be complacent right now because it can still reverse. And if the reproduction number starts increasing above 1, then it's going to be a long battle against this pandemic. But right now, we hope that for the next few weeks, we could sustain it at less than 1.
Sir Guido, speaking of next weeks to come, the government is set to decide on the new quarantine status. What would be your recommendations?
Well, I think we could still look at the prevailing trend by early next week. That being said, ECQ is probably out of the question because the situation has been improving. So the government could probably opt for an extension of MECQ and perhaps maybe loosen some quarantine restrictions in the process if it wants to do so, but not easing the restrictions with respect to activities that are high risk. For example, indoor dining should probably not be allowed yet because of the airborne transmissibility of the virus. But we can probably increase capacity a little bit in some establishments, for example, from 10 to 20%. I mean, those are possible. We're not necessarily recommending those, but if the government decides to, for example, move to GCQ, it should do so very gradually and not rush things because we might lose the gains that we made over the past few weeks.
Thank you, sir, as always, for your time and for your insights. That's Octa Research Fellow, Professor Guido David. Now, although the Health Department highlights the need for a wider COVID-19 testing, Undersecretary Maria Rosario Vergere clarifies that this doesn't mean a mass testing will be conducted. Instead, Vergere explained that targeted testings needs to be expanded. She said officials will look into conducting house-to-house tests with help from local government units. The official added that only those with symptoms or who had exposure to COVID-positive patients will be tested.
Ang gagawin po natin, yung pong pagbabahay-bahay is for us to identify immediately those individuals who are sick para matanggal na po natin sila sa kanilang bahay kung sakali at mai-isolate natin sila. So by doing this, yung pagtetest po natin is still targeted. Pupunta tayo sa mga bahay kung sino po yung dapat nating itest because they have symptoms or they were exposed, yun po ang itetest natin. But this is not mass testing.
Now, as the global inoculation drive is now on full swing, U.S. pharmaceutical firm Pfizer plans to manufacture a new version of its jab that is ready to use and can be stored in a normal freezer. From the negative 70 degrees Celsius storage requirement, Pfizer plans to make a version that can be stored in negative 20 degrees, making it cheaper and less difficult to distribute. The U.S. firm also intends to provide their jabs to low-income countries on a non-profit basis, while for middle-income countries, it will be half the price of what they offer to high-income nations. Now, here are other stories we're keeping our eyes on. Rescue operations for the 53 crew on board a missing Indonesian submarine continue. Indonesia's Navy said an object with a high magnetic force had been spotted floating at a depth of 50 to 100 meters. Aerial search had earlier spotted an oil spill near the submarine's last location. SpaceX launched a new 4-astronaut team on a flight to the International Space Station. The mission marks the second operational space station team launched by NASA since the U.S. resumed flying astronauts into space last year. This is also the third crewed flight launched into the orbit under NASA's public-private partnership with SpaceX, the rocket company founded and owned by billionaire entrepreneur Elon Musk. And Caitlyn Jenner, a former Olympic gold medalist and transgender activist, announced her plans to run as governor in the state of California. The longtime Republican is seeking to unseat current California Democratic Governor Gavin Newsom in a recall election. Jenner slammed Newsom over restrictive lockdowns that have devastated small businesses and deprived children of in-class schooling. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.